Hi, this is Josh. I'm a pharmacist with pharmacisttips.com. Just to talk to you a little bit about switching from the medication Lisinopril to the medication losartan. First off, what is Lisinopril? Lisinopril is a medication known as an ACE inhibitor, and they're used to treat high blood pressure. They may also be used for other conditions after a heart attack or in diabetics to prevent kidney damage. They come in anywhere from 2.5, 5, 10, 20, 30, and 40 milligram tablets. Now, they may cause a cough, and that's one of the reasons that they may be discontinued. Rarely, they can cause some serious swelling in the face and neck, something you may hear called angioedema. And they can also increase potassium levels in the body. It's something your healthcare provider can monitor with labs. Okay, so what is losartan? Losartan is a similar medication called an angiotensin receptor blocker, or sometimes abbreviated ARB. It is also used to treat high blood pressure. However, it comes in 25, 50, and 100 milligram tablets. Side effects, it can sometimes affect blood sugar. Again, we can have that issue with potassium, some drowsiness. Cough can occur with this one as well, but not near to the extent that we see it with lisinopril. So why would your healthcare provider want to switch? Well, most likely it's because you're having side effects with lisinopril. Probably that cough is what we see most commonly. Other side effects could warrant changing as well. So switching to that losartan still is going to provide the benefits that you see with lisinopril with extremely less incidence of cough. Or your lisinopril simply isn't working, so they're going to, try on something different would be another reason to switch. So how to switch? It's your doctor, your healthcare provider, your GP will help you determine the best way to do it. Usually, if you're taking lisinopril 10 to 20 milligrams, you'll probably be started on losartan 50, lisinopril 30 to 40, probably somewhere around losartan 100. Again, it's up to your doctor to determine the correct dose, but that's kind of a ballpark figure there. And it's pretty simple. You'd stop lisinopril one day, you start losartan the next. With any blood pressure medicine, it's always good to monitor your blood pressure to make sure that it's working well for you, getting your blood pressure in the range where we want it to be. The first dose or two, we want to watch for that swelling in the face or throat, of course, because that's a serious reaction. And if the swelling's really bad, you'd want to seek immediate medical attention. And they'll check your labs, monitor your potassium, see how it's agreeing with your body. Again, most people do just fine, but it is something that needs to be checked because occasionally that does run amok. All right, thanks for watching. This was a little short video just kind of explain how you switch from one blood pressure medication to another. Ask your questions in the comments below. And be sure you always contact your healthcare provider if you have problems or concerns. If you're on blood pressure medication, it's a good idea to monitor your blood pressure on a regular basis. And if you appreciate my information, I'd love it if you'd subscribe to my channel. Thanks for watching.